The healthcare industry is moving towards a new era. Worldwide, consumers are embracing the transformational power of technology, steadily moving from paper to e-records and e-health applications. 76% of patients say the use of technology to manage their health has the potential to improve their health greatly. At the forefront of this revolution are companies like ECLINICAL WORKS that are extending the use of electronic health records beyond the practice walls and creating community-wide records.
11.8% of all electronic prescriptions that are written every single day, month and week. About 15 million of them every month are written by doctors that use ECLINICAL WORKS.
Spread across 9 data centers, ECLINICAL WORKS' grid cloud keeps patient and practice data safe and fully accessible, regardless of time, network traffic, and even natural calamities. More than 20 crore patients, 8 lakh healthcare professionals, and 70,000 hospitals and clinics in the US use the ECLINICAL WORKS platform for a unified solution for patient engagement, revenue cycle management, and population health indicators.
Hello and welcome to our special show. ECLINICAL WORKS presents Redefining Healthcare with IT. All across the world, the intersection of healthcare with information technology is changing fundamentally the way this industry works. It's creating effective, efficient, and affordable ways of providing healthcare that is of high quality and error-free. Today, we will discuss the nuances of this convergence. We have with us Mr. Sameer Bhatt, who is co-founder and vice president, ECLINICAL WORKS, and Mr. Akash Shah, who is director sales, India and international market, ECLINICAL WORKS. Welcome to both of you.
I'm delighted to be here.
Thank you for having us.
I'd like to share with both of you that we have a segment, a special call-in segment, where our callers will call in and talk to you as to how this convergence of healthcare and information technology will better delivery of healthcare in their daily lives. But for now, my first question to you is, Sameer, is that in the West, hospitals and clinics are converting their paper records into e-records. What does this transition entail, and more importantly, how has it been received?
In 1999, when we entered into healthcare with our technology platform, when we looked at the doctor's offices and how healthcare was delivered to patients, it concerned us and how little the technology was used at point of care.
Yes.
Less than 3% of the physicians were using technology at point of care. And none of the patients had access to information online. Fast forward to 2015, I mean, if you look at US population today, 320 million lives in US, 220 million of them have an electronic record with ECLINICAL WORKS.
That's a very good statistic.
Yeah, and I think it is the transformation was not easy, and it was hard. But today, the patients are able to use the online platform to communicate with physicians and hospitals and get better care.
A conversion of paper records to e-records in India, is there a challenge on that road?
Well, there's a slight bit of challenge. What we are seeing is, government mandates hospitals to keep paper records for some number of years for certain cases. But other than that, people get excited when they can actually go back and free up all the space which was filled up with the big fat files. So there's a challenge. We are seeing a lot of government reforms coming into place as well, where they want to adopt EMR, electronic health records, more and more. This is exciting times right now. I think the adoption of technology should be pretty fast in India.
I believe $750 billion were wasted annually in healthcare in the United States alone.
Absolutely right, absolutely right. And we are trying to use tools and technologies, help the patients as well as the physicians and hospital systems, and eliminate the wastage that is happening. And patient is going to a primary care doctor's office, and the doctor is referring the same patient to a specialist. There are a variety of lab tests that are getting done at the primary care office that are repeated once again in the specialist office. And we want to make sure that we are eliminating those duplicate tests that are getting performed. And we have achieved some significant reduction in the healthcare costs already. And there is a long way to go. And the next 5 to 10 years are going to play a key role in, technology will play a key role in further reducing the healthcare cost.
If anything, technology will better the healthcare journey of patients across the world.
No doubt.
If anything.
No doubt.
We have our first caller online.
Excellent.
Mr. Mitra is calling from Kolkata and he has a question for you. Mr. Mitra, please ask us your question.
Yeah, I'm a private physician in Kolkata with my own clinic, as well as I'm visiting consultant in 2 or 3 hospitals. I would like to know from this show how the modern technologies and digitization is going to help me in taking care of my patients and having all the records in an organized manner.
Thank you for the question there. I really appreciate call coming from a doctor. Let's start with some basic things. And as a doctor, if you're using an electronic health record platform from ECLINICAL WORKS, first thing that you have access to is number of appointments that you have today. You are able to plan your day really well. Try to find out the type of patients that are coming in to see you.
Yes. And
it helps you to start planning how you are going to treat and manage these conditions for a variety of patients that are coming in. Now when patients walk into your office, there's a lot of information that you need to deal with to make better decisions and right decisions at the point of care. And all that information is available for you electronically. And at the end of the day, as a doctor, you're writing all these prescriptions for a variety of things, but you can start thinking about prescribing an app for your patient. And it's a new dimension, and because you want the patient also to be accountable in the entire care management. That's really an interesting concept that is emerging in different parts of the world.
As you're talking to me, I'm feeling the excitement and I'm saying, when is this going to, come into India and roll out full force? Okay, we were just talking about EHR. What is ECW doing to optimize technology in healthcare, and what are the other technologies that are coming out of the ECW lab? Tell us.
Right, one of the exciting things that I'm personally really looking forward is a telehealth technology that we are launching in 2016 in India. And let's look at a problem in India today. There are many physicians in certain parts of the country that are looking for patients. And there are other parts of the country where patients are looking for the doctors.
Looking for physicians. Yeah.
Looking for physicians, and they don't find one. And our telehealth platform can connect them with each other. And that's transforming healthcare delivery. And we are excited about the opportunity that we have. And I think we will be able to leapfrog this entire healthcare delivery system, introducing a new way of doing things rather than traditionally. Our approach was to build brick and mortar clinics in every single town and center. Yes. And if I compare this to telecommunication industry, we were laying telephone cables to go to every single town and city, but cellular revolution changed that entire process, and we were able to connect, get people on the phone network a lot faster. And I think we can probably do the same thing in India with telehealth platform.
Yes, we can. We have another caller wanting to talk to you.
Okay.
Mrs. Madhuri Sharma from Delhi, and she has a question for you. Here it comes.
How is a commoner like me benefited from this revolutionization of healthcare? In other words, how do these services improve my next visit to the doctor?
Great question there. Number one, when you walk into an airport today and you want to check yourself in, most of us don't go to the check-in desk. We go to a kiosk.
Yes.
And because we like the experience of breezing through the check-in process, and if you walk into a physician's office that is using ECLINICAL WORKS platform, you'll be able to use a kiosk to check yourself in so that you don't have to wait in lines and pay for the the visit as well using credit card right there at the kiosk. That's number one. And as you go through the visit, as I talked about the ability for a physician to give an app as a prescription. So the physician will be able to provide that access to the app, which will provide access to the medical summary and summary for the visit. Once you go back home, you can access all the information right from your smartphone, number one. And number two is you'll be able to set alerts for different medications that were prescribed by the doctor so that you don't have to remember 5 different medications at what different times I should be taking those. And the phone will start sending you messages. That's a great concept. But going from there, there is an interesting thing that you will be able to do. If you want to manage various different health parameters, if you are trying to track your blood pressure or your glucose or weight over a period of time, the smartphone app that we have built allows you to track those health parameters. But in addition to that, if you are using health monitoring tools at home, such as a blood pressure cuff or a glucose monitor, you'll be able to download the readings from those equipments onto your phone. And the best part about that is next time when you go to the doctor's office, you'll be able to share all that information from the phone.
Wow.
And doctors will be able to make better decisions for you. And the best thing here is you don't have to worry about those big fat files that you carry today and take them to the doctor's offices. And that's the...
And forget a few important ones at home.
Exactly.
And then go back again to the doctor. Yes. There's a phrase called life-altering experience. I think this is a healthcare practice-altering phenomenon that is going to, hit the world in a big way in the next few years. So we will now slip into a short break. On the other side of the break, we will come back and talk to them more about the convergence of healthcare and information technology, but this time India specific. Stay with us. Welcome back to eClinical Works presents Redefining Healthcare with Information Technology. We are talking to Sameer Bhatt and Akash Shah about the convergence of healthcare and information technology and how it's changing the world of healthcare, really. Welcome back.
Thank you.
Thank you.
What are the ground realities in India? In India, are we lagging behind when it comes to enabling the application of technology in healthcare? And are we ready to adopt cloud-based solutions?
Well, let me put it this way. Currently, if you want to hire a cab, book a hotel, movie ticket, what do? We pick our smartphones,
Yes.
download the app,
Yes.
get the work done. Well, it's simple cloud technology at work. So we've been using cloud technology day in and day out without even realizing that we are already in that space. Somehow, healthcare sector has always been talked about with a mental block and a myth.
Yes.
So we think now is the time that for healthcare, cloud should not even be a question. Not just that, with the Digital India drive that the government is pushing, we are seeing a lot of adoption of technology with everyone, not just the younger generation. And we are seeing a great positive change when it comes to using applications which are not just on cloud, but applications used by hospitals, physicians, and the patients. So we are thinking that this is going to really change how the healthcare is defined.
We have another caller on the line. Mr. Rajiv Sharma is calling from Mumbai, and he has a question for you.
Sure.
Mr. Sharma, you can ask your question, please.
I work at the IT department in a hospital based in Mumbai. Wanted to know what are the different options that you would provide to implement such a software solution to a small or a medium-sized organization like us. Considering the huge amount of costs that involve in purchasing as well as maintaining servers and data, do you think small and medium-sized hospitals can also take advantage of such softwares and technology in today's world?
Regardless of the size of the practice, it might be small or medium, cloud is the way to go because it helps you in reduction of costs. You'll not have to worry about the upgradation of hardware and software, and it's kind of a worry-free environment.
That's absolutely right. When we look at our cloud infrastructure, I think that's one reason why we have succeeded in this space, is we are taking the entire question or concern from the physician's mind. Is the server running or going to be running today or tomorrow or day after? Take that out of their head and let us worry about that, and let the physicians do their job of taking care of patient lives. I think that's huge.
So they don't have to worry about backups, recovery of the data. At the end of the day, they stress or they look into what they are good at, which is patient care.
Absolutely. How does big data contribute to more efficient delivery of healthcare practice?
Yeah, big data is very important for improving the healthcare delivery, and let me give you some examples that'll help you understand. Let's say I'm planning a trip to a city tomorrow.
Okay.
And you and I know that we do one thing first, which is look at the weather map.
Yes.
And see if there are things happening there, a storm coming, and I want to probably avoid going to that specific place. Well, if we start using big data from healthcare, we can start creating hotspots of outbreaks that are probably happening across different parts of the country. And think about looking at a map, very similar to a weather map, and making decisions as to whether I should be traveling to this part of the country because there's some outbreak that is probably going on, maybe a chikungunya or something else. I'm taking an extreme scenario here, but big data has a lot of potential, both from the government point of view and policy point of view, as well as a citizen. I can make better decisions because we know one saying that we always believe in: prevention is better than care. A cure. And I think if we can start using big data for some of that aspect, that's, I think, is a step forward.
How do you envision the world in the next few years with respect to healthcare and technology?
Well, if you look at the population in the world, then I think India comprises of 17 to 18% of the humanity. And we just talked about it, right? The average age of all of this population in India is 26 years or 27 years. So I think we are making a huge impact globally and in India by giving the technology at an effective and affordable way, and at the same time delivering the care at the point of contact.
Think about a patient that is looking for a second opinion who lives in India, and maybe an expert that is available some part of the world, US, UK, or some other country. There is no mechanism today that is available for a patient to reach out to that healthcare provider. With telehealth platform, we are going to eliminate all those boundaries and provide the technology platform which allows patient to have those second opinions a lot easier and effectively. That's changing healthcare, and that's changing healthcare in a big way. We are eliminating the boundaries, and this has happened in e-commerce, as we know, and this can happen in healthcare. Why not? At the end of the day, our mission is to provide a technology that is smarter, that is faster, that is convenient at an affordable cost. And that's what we do, and that's who we are, and we are excited about the opportunity in India.
And I think my takeaway from that is that it can happen in healthcare. Why not?
Absolutely.
Yes. Thank you both very much for talking to us. Thank you.
Thank you.
Well, what can I say? The world is changing out there. Technology is disrupting and transforming the way businesses operate. Traditional means of operation are all going out of the window. New ways are all coming in. Here's looking to a new world of healthcare with the intersection of technology. Thank you for watching.